I'm Dr. Wajiha Javed, and I'm the head of public health at Getz Pharma, and I'll be your host throughout this web series. So why should you be tuning into the public health line? Getz Pharma, through the public health line, brings to you a multidisciplinary academic format where you can have question-answer live session with a series of international experts from around the world on issues like health system strengthening, public health, policy, advocacy, economy, etc. Next episode begins shortly, so please stay tuned. We aim to learn from you as much as you aim to learn from us. Hi everybody, good morning and good evening from wherever you're participating around the world. This is Dr. Wajiha, and I'm the head of public health at Getz Pharma, and I come to you with Public Health Line from the platform of Getz Pharma. Welcome to the second episode. The title of the second episode is Economic Impact of COVID-19 and Revival Measures that the World has Taken Over. We have our esteemed panelists and discussants today from around the world. We have with us participating countries from Philippines, from Pakistan, and Sri Lanka. So let me introduce my panel of experts and discussants to you today who will be with us and who will be talking about the economic impact of COVID-19 that we've had. First of all, I have with me Mr. Murtaza Solangi, who's joining us from Pakistan. He'll be our discussant today throughout the series. Murtaza Solangi is a professional journalist and a broadcaster. He's currently the executive director of Neador Media. Previously, in his previous capacity, he served as Director General for Radio Pakistan. He's been a journalist for the Voice of America, and he was a Vice President of the Asia Pacific Broadcasting Union. So welcome, Murtaza Saab, on the show. I have with me today Dr. Kaisar Bengali, who is one of the leading economists of Pakistan. Dr. Bengali comes with an experience of around 45 years in teaching, research, and policy advice on economics in Pakistan. He holds a Master in Economics from the Boston University, US, and his PhD in Economics from the University of Karachi, Pakistan. He serves as the Managing Director for Social Policy and Development Center, Karachi, and he's worked in the Economic Affairs Division and the Head of Chief Minister's Policy Reform Unit, Government of Balochistan. He was also the SIND's representative on the 7th National Finance Commission and is currently nominated on the 8th National Finance Commission to represent Balochistan. So thank you, Dr. Bengali, and he'll be representing Pakistan today and will be talking to us from a country perspective of Pakistan. We have with us Dr. Alvin Ang, who is joining us from Philippines. Professor Ang's career in economics spans over 3 decades in economic development, specialist investment analytics, as a corporate planner and as a lecturer. He's currently a professor in the Department of Economics in the Manila University, and he's also currently serving as the director for the Economic Research and Development Center. His special areas of expertise include labor and migration, urban and rural development, competitiveness, and macroeconomics. So welcome, Dr. Alvin, today to the Web Talk Show. We aim to learn a lot from you. We will also have Dr. Vasanda from Sri Lanka join us. He's having some technical difficulties at the moment, but he'll be joining us shortly. He is the professor of economics in the University of Paradentia, Sri Lanka. He holds a PhD in economics from the Queensland University, Australia, and his field area of expertise is environmental economics, agricultural economics, and sustainable development. So everybody, welcome to the show. One of the reasons that Public Health Line came into existence was because we felt that there was a gap when we were all talking about health issues at a primary healthcare level. As you all know, according to the WHO definition of health, health is not just the absence of disease, but it's also a state of mental, physical, and social well-being. When we say social, it comes with a lot of its own insights around economics, around politics, around policy, around sustainable health, etc. One of the reasons why we have a diverse group today with us who will be talking on the economic impact that COVID-19 left us with is because health is nothing without economics, and one impact on health is going to leave a big chunk of impact on economics as well. I'm just going to start off with a little introduction. It's no rocket science that COVID-19 left us with huge losses. It left us with huge labor forces, left unemployed around the world in different markets, and specifically in different industries, specifically like travel, transport, and tourism was affected massively. There was a consumption loss of around US $3.8 trillion, and it has ranged from each country. Some countries were affected a lot, some countries were not that much affected. I would first of all like to start off with a very simple definition. I also, forgot to introduce our social media partners, who are universities who are with us on board, who will be airing this program live to their students and academics and professors in the circle. We have with us the IBA University from Pakistan. We have with us Dow University from Pakistan. We also have with us Habib University, and we have with us, we have with us GK also from Ghulam Isaac Institute, also from Pakistan, so welcome on board. I would like to first of all, for our viewers who are not economists and who are not from the field of economics, Dr. Bengali, if you could just give us a little definition of what is meant by consumption losses, because my next question is going to be around consumption losses. For a layman, what is a consumption loss?
Thank you, Dr. Wajiha, and hello to everybody. All living beings, human and animals, we need to consume because that gives us the energy and the nutrition to be in good health and survive. In order to consume, we need to have some purchasing power because we need to purchase whatever we want to consume. And this can be food, it can be clothing, housing, education, health. These are all consumptions that we have to lead a wholesome life. In order to have a purchasing power, we need to have an income. Income means that what comes before consumption is production. We have to produce something to be able to consume. Of course, it's one person's production is another person's consumption. So this is, and so if someone is growing wheat, then we have bread on our table. And if that process is disrupted at any point, then the end point of this whole economic chain is consumption. And so disruption causes consumption to suffer.
Okay, great. Thank you so much. I would like to now invite Dr. Alvin to talk about what was the consumption loss, particularly in effect to Philippines. What kind of businesses were affected the most? And if you would, whether do you think those consumption losses were also related on a country scale with health impacts, or were they correlated, or were they completely different from each other? Dr. Alvin, over to you for a country-specific analysis of Philippines consumption losses. Could you?
Okay. Yes, thank you very much. I'm going to screen share so that you can see the impact in a nutshell. Can you see it?
Yes, we can.
Okay. Yeah, this is a comparison of 6 countries over the last 6 months, and I'm based on the question on the impact on consumption. The most basic consumption that we can see is in retail, the daily things that we buy, and then including the supermarket, and then pharmacy, medicines, and the likes, and our recreation. And you can see I highlighted here the Philippines across these countries has the biggest decline in consumption, meaning people were not able to consume as much 6 months ago. So it really has an impact in the way of doing business and confidence in our country. And that shifted also. I also look at data, 2 periods that you can see that people actually shifted their consumption. Yes, they're still consuming, but not as much. So they gave up restaurants and hotels. They gave up some transport and shifted it to food. So it's like people are put into the context of just focusing on the essentials, and this is what we have reflected in our data that came out about June this year. And so people now prioritizes communication, utilities, and then miscellaneous goods and services, meaning adjustments that the things that they were not consuming before, they're consuming now. And there's a lot more consumption in food. So this is how it was in the Philippines, basically.
Great. I'm going to have divert the same question over to Dr. Kesa Bengali. What kind of a consumption loss pattern did we see in Pakistan? Was it similar to Philippines? Was food and basic necessities they saw a rise, or was it any different here? And I would also like to add that are they related to government policies? Because, for instance, if transport is blocked, if transport is not happening across the country, public transport is shut off, it will automatically lead to a decrease in consumption.
I don't have access to actual numbers, and I'm not sure if
you could just give it a
study as comprehensive as Philippines has been undertaken here. But certainly consumption losses are widespread because unemployment and income losses are across the board. Losses cut across the spectrum. Even self-employed people became unemployed. Retail shop workers, retail shop owners have suffered income losses because their sales have dropped. So the income, the unemployment and income losses is across the spectrum, and it is not just daily wage workers who have suffered. In terms of composition of consumption, there were no food shortages. The supply chain for food did not get disrupted. That continued. But because of the loss of income, certainly consumption patterns suffered. Now, for the very poor, whose 70% of their income went into food purchases anyway, and if that income disappears, their food consumption has also dropped. And there is anecdotal evidence and circumstantial evidence to show that food consumption of the poor has dropped.
So I have a question. Okay, so I have a question here for Murtaza Saab. It's generic also. If anybody else also wants to answer, they can. Did you see that there was any sort of a consumption loss globally according to the GDP of the country? Did you feel that rich countries had a different sort of consumption loss and poor countries had a different one? And also from within a country, was consumption losses any different when it came according to the wealth quintile? Were the rich the same, or were the poor more affected? How was it across the spectrum?
What I have observed is that the developing countries or the poor countries had more consumption losses because of the lack of entitlements. In developed countries, there are some social safety networks like savings, social welfare programs, ration cards, lot of other schemes that you find in Europe and North America that have been non-existent in poor countries of different regions, including South Asia. So it has been more of an entitlement issue. There were a lot of supplies of food, but people's access to food items because of loss of income and lack of social safety networks, that caused a lot of disruptions, as Dr. Kesar Bengali rightly pointed, and so did Dr. Alvin, was that people had consumption losses and they shifted whatever the meager resources they had towards mere subsistence like food. People already had very small disposable income. So whatever they had was shifted towards mere subsistence, and the amount of food intake per family unit, that went down.
Great. Thank you so much for the analysis, Murtaza Saab. I would like to now divert again to Dr. Alvin and Dr. Bengali. Do you think COVID-19 is going to shift a change in consumption over time? Do you think now that the human race we were just living with essentials for a good period of 6 months without luxury, if you may allow me to call it, do you think that pattern is going to stay the same or will it change? What do the economists think?
Yeah, let me try to answer it. Well, I think the most critical element of this crisis is confidence. Confidence, meaning people can go out, people can do business, and while we are still uncertain whether there is a vaccine or whether the health protocols are very clear in different industries, in different places to go, we are actually being pushed in some kind of an adjustment situation. And so the shifting of consumption has already been there, and people are being moved towards the less contact, online, digital economy. And so while consumption might have shifted, it's not very easy to go back to the pre-COVID situation, because the challenge is, as I said, there's not much confidence to go back to that path as before. And most likely, I'm not a health expert, but looking at the previous length of pandemics, about 2 years, then people will get used to this kind of an environment where they go out with masks, with face shields, very limited social interaction. And so until we have the confidence that we are able, here in the Philippines, we call it dancing with the virus. If we can dance with the virus and avoid being contracting it, then I guess the consumption pattern will remain as subdued as we are seeing right now.
Dr. Bengali, what do you think about Pakistan? Do you think we'll bounce back to our original consumption patterns, or is it going to change? We do see a lot of small businesses that were already closed and that have no, program of coming back into existence.
It all depends on how the macroeconomy performs and how the government responds to those macroeconomic changes. One fundamental change that has come about, is that globalization will take a back seat. And countries will have to, in order to ensure that consumption levels do not fall and are protected, countries will have to do a bit of autarcism, which means that you produce something which is essential, even if it can be imported cheaper from abroad, because we will not have the dollars to import. And we will not have the dollars because, talking of Pakistan, about 60% of our exports go to North America and Europe. And with these two regions in recession, our exports will fall. 60% of our exports is 70% of our exports is textiles. When exports fall, textile industries will shut down, and that will create joblessness. About 2 million of our workers are in the Middle East, which again faces recession. These workers are beginning to come back, so our remittances will also going to fall. So what we will need to do at the macro level is reorient the economy from an export base to a domestic consumption base. Our economy will have to produce for domestic consumption. And with a 200 million plus population, this is possible. So but if the government does not do that, then the mass unemployment that we can foresee with textile industries shutting down, with our workers returning from the Middle East, it is dependent on how the government restructures the macroeconomy. And if it can do that, for example, if you are not going to export textiles, we don't need so much acreage in cotton. And that cotton acreage has to be shifted to, so that and that kind of restructuring will be needed. If that restructuring does not work.
Okay. My next question here is going to be to, again, Dr. Alvin and Dr. Bengali. Can you tell us the impact that we have had on job losses, full-time job losses? Globally, I was just looking into figures. We've had job losses of around 400 million globally. That's huge. So almost it's being said that 4.2% of the global workforce has gone jobless. And these are just documented figures. I'm sure the figures are way above this because these have been taken from insurance websites, etc. Our trade and transport industry was the most severely affected. Around 11.9% of workers from 20 nations in a survey have registered themselves as unemployed during the COVID-19 pandemic. This almost represents 58 million workers across the world. Now, how has the impact been in Philippines and Pakistan? So first I'm going to ask Dr. Alvin to answer. Then we'll go on to Kaisa Saab. And Murtaza Saab, could you please also give us a highlight of what has been happening globally and whether you see it coming back and reviving in due time or not? So Dr. Alvin.
Yeah, let me show you a chart of unemployment in the Philippines during this pandemic. We actually experienced the worst unemployment numbers. It's a minus 17% decline, and that translates to about 8 million people losing their jobs. However, in July, end of July, we had another survey, and it showed that the unemployment went down to 10%. So about 7% were regained. So, but still about 5 million losing their still out of jobs, and that's quite substantial because the average unemployment rate in our country is just about 2 million. Number of unemployed is about 2 million, which is about 4%. And we also see that the unemployment pushed many people to become self-employed. So one of the things that we can see here, become online entrepreneurs. So there's a lot of online activity going on right now. A lot of people who lost their jobs became self-employed. And if you look at the sectors that gained in this COVID situation, actually, it's not all losses for all the economies around the world, just like what Professor Benzali mentioned earlier. the jobs by sector, there are gains. So for example, he was mentioning about agriculture related. So we have seen that because you really need to grow your domestic economy at this time, because global trade is at a standstill or very weak. So we have seen growth in agriculture and induce construction by the government. Also, you create jobs for public construction like road, bridges, infrastructure, and the likes. And similar to Pakistan, the Philippines also has a large migrant worker population around the world. And we are actually expecting about 400,000 of the more than 4 million working abroad to come home. And so that's really a huge challenge for us as well. But having said that, the domestic economy is really what you need to rekindle and you re-strengthen. And it's like with a large population similar to Pakistan, you can create internal demand for economic activities to continue, and so try to limit unemployment by giving small job opportunities in construction and the like. So it's really part of public or government activities to be able to do that.
Professor Alvin, are you there?
Yeah.
Yeah.
Yes.
Okay. So now my question here, you were talking about domestic build-up and internal jobs within the country. But if people don't have money in their pockets to employ others, or if salaries are cut down, and if you're talking about self-employment, could you highlight that a bit more, that what kind of industries would be suitable for middle income and large income countries? What kind of businesses are we talking about for self-employment from within a country?
Am I to answer that?
Yes.
Dr. Wajid? Yeah.
Please.
Well, as I mentioned earlier, some of the jobs.
Yes, it's for you.
Yeah, many of the jobs that are not really lost. No, there's also like a transition to other industries. As I said, in many countries, everyone is trying to go for trade, but in this particular situation right now, there is a rekindling of agriculture. People want to go back and produce their own food and generate economic activities out of there. And COVID basically is not affecting so much agriculture, and so there's a lot of opportunities in that aspect. So I think we have an opportunity that is very available there. It can help the poor, and it can also help the middle class who can generate a little agricultural activities. Also, tourism can be created in what is called as bubbles. I mean, you don't need to have a lot of economic activities that is so widespread. So it can be concentrated. You can have concentrated tourism in particular regions. So that is something that can be for the meantime can be done. Thank you.
Okay. My next question is to Kesar Bengali. Are you able to hear me? Dr. Bengali, are you able to hear me? So my question to you is...
He needs to unmute himself. He's muted. He needs to be unmuted.
Dr. Bengali, if you're able to hear me... No, he's lost. Okay, my next question is to Murtaza Mr. Murtaza.
Go ahead.
Mr. Murtaza, are you able to hear me?
Yes, I can hear you. Can you hear me? Can you hear me?
Okay, great. So would you like to okay, yes, I can. Would you like to give us a case-by-case analysis of different countries by their economic status, low, middle, and high-income countries, what the kind of unemployment they faced, and which sectors specifically was that for? On a global trend analysis, just give us a trend analysis for unemployment.
Uh, Thank you, Wajiha. As we have seen in North America and Europe, the biggest hit sectors of the economy are transport and tourism. And the way this novel coronavirus is acting, especially in United States, um, there are a lot of questions how long it will continue before the vaccine or anything else happens. So, in terms of job losses, that would remain the Achilles heel for North America, Brazil, United States. That's where it would continue to hurt. We do not know when United States and Europe would come out of it, because they are also markets of lot of exports from developing countries like Pakistan and Philippines. As Dr. Kesar Bengali rightly told us, that our main exports, textiles, mainly go to Europe and America, and if they are in recession, the demand is lowered right there. So the overall situation globally would continue uh, towards the downgrading. And as it has been pointed out, the overall trend would be inverse. The global networking or global trade network is almost shut down. Isolationism is the new currency. The way it's affecting our region, like South Asia, um, unlike Europe and America, where there are a lot of linkages, European economies are integrated and there's a lot of interdependence and trade going on. While our region has very little interdependence in terms of trade, especially in South Asia, Pakistan and India, because of their conflict. There is a big east-west Berlin Wall that's hindering the trade linkages between different South Asian countries. Like Indian market produce and products can't go to Central Asia because of a rivalry with Pakistan. So this will remain for a long term. In our region, I can fairly say that micro, small, medium-sized enterprises are the biggest hit. So overall, our revival would be more in terms of agriculture, but globally, the tech companies, the pharma companies, health industry, agriculture, domestic tourism, there is hope. But other than that, you would continue to have job losses, and this economic downturn would affect entire world, including our overseas Pakistanis, around 3 million who are working in Gulf countries, because their economies are suffering as well. So the demand for oil is also less global.
Okay. Which brings me to my next question here. If Dr. Bengali is here, I would like him to answer this. So I'm just going to read off a statement reduction in income from wages and salary has seen an impact of a $2.1 trillion, which is 6% due to COVID-19. So other than just job losses, private sector and a lot of other enterprises have reduced salaries also. Who would like to comment on that from my country panelists? I see that we have our speaker, our panelist from Sri Lanka also, and I think Bengali Saab is trying to join in. So whoever wants to go first, I'm more than happy. Dr. Vasanta, are you able to hear us?
I can hear you, but actually, this is just now I log on to the system. I don't know what was happening. At the beginning, were you allow us to make a presentation or whatever? I don't know.
No, we are live, Dr. Vasanta. We are already live. And my question here right now is to my overall panelists. We talked about consumption losses. We talked about out-of-job market. My next question is, like I said, I was reading the statement that there has been a decrease in income and wages also. So how has Sri Lanka been presenting on that? You can just talk about figures generally. You can just answer the question. No need for visuals or a PowerPoint.
Right. Now, in terms of Sri Lanka, if you think about the number of cases are very low, it's around 3,000. And also number of deaths is like 12. It's at the minimum level, right? Therefore, in the country, there was like 4 months we had the lockdown. After that, all the activities, economics and other activities are going on very smoothly now. There is no any issues because there is no, after 4-month period, there is no lockdown period, and because COVID is not found anywhere from the society. It is limited to the quarantine center, right, where we bring the foreigners, and therefore those centers, we every day we find 5, 6, 7 and so on. The other places in the country, there is no, and normally from the society, we couldn't find anyone over the last last like 2 months. Therefore, the economic activities are going very well, and social activities are also remain normal. That is the general situation in Sri Lanka. But if you think about the aggregate consumption loss, income loss, wage loss, and those things, we had a lockdown period like 4 months. Those periods, everyone was affected heavily, but government gave a lot of subsidies to those affected people at that time. Therefore, I think except the urban communities, urban limited number of people, right? Communities, all others are not severely affected.
Okay, thank you. It's good to see that we have a country example which has very less effect. Dr. Alvin, would you want to talk about Philippines, about wage reduction? Similarly, Murtaza Saab, Mr. Murtaza, because we don't have Dr. Bengali with us on board, if you could just highlight about Pakistan also. So Dr. Alvin, if you could go first about reduction in income from wages and salaries.
Yes, as I already mentioned earlier about unemployment, which is large, so the impact is actually impinging, coming from the industries which are having very difficult times at this time, at this current stage. We have seen many companies actually close down in the last few months. And many of them are in the areas of in the areas of wholesale trade, in tourism, and some manufacturing as well. It's a big challenge at the moment for the Philippines how to address this, because the government has very limited resources to be able to provide for loan and subsidies for the small and medium enterprises, and this is really as I mentioned earlier, the challenge is to bring back the confidence, because even if you provide loans and guarantees to these enterprises, but they cannot have they don't have patrons, no customers, no consumers because of lack of confidence, then it will just be a cycle. So it is very important that you address first the confidence factor, and then the rest, the firms will be able to go back to their operating ways, because this is not a simple crisis, and so you need really to help each of the industries find the right protocol, the best way to deal with the virus until the vaccine is produced. Yeah.
Thank you,
Thank you.
Dr. Elvin. Mr. Murtaza, if you could tell us about Pakistan, and after this particular question, I'll move on to revival mechanisms that have been put in place in different countries.
Thank you, Vajiha. One of the important things that we have witnessed globally is wage losses and wage reduction. That's almost global. You have seen it in airline industry, where employees were asked to either take unpaid leave or agree to work on lower wages. We have seen that in Pakistan. If you talk to anybody in the media industry, the television and the newspapers and radio stations in Pakistan, from top to bottom, from the top executive to the lower level, you go to a TV station, they'll tell you, from cameramen to editors to reporters to people working in the newsroom are holding executive offices and anchors. There has been percentage-wise massive reduction of salaries besides job losses. If you look at Pakistani figures, I was just looking at one of the figures quoted by one of the investment banker, Khurram Shahzad, who said Pakistan economy would be struck with at least $15 billion loss to GDP. Now that's huge, because we already have around 66% of the population, are 145 million people living in poverty. So this is almost global. The wage losses in different sectors of the economy, and in the near future, as the demand for Pakistani exports and textile goes down, you would see more and more units closing down, and only sectors that we already discussed, like agriculture, pharma, barely surviving.
So I see that across board, across all countries, at least those who have been hit. We have an example of Pakistan and Philippines. Sri Lanka, on the other hand, was not affected that much. But I also had a graph in the beginning that showed that the health impact, at least in terms of death, had got nothing to do with the economic losses. Is that true for all countries? And why would that be? Because that surprises me a lot. There are countries on one end of the spectrum who had a lot of deaths and who did not have any economic losses. Then on the other side, there were countries who had no deaths and a lot of economic losses because of COVID-19. Did it have anything to do with policies? Again, that's an open question for all my panelists and discussing. Whoever wants to go first.
Let me answer that, Dr. Wajia. Yeah, I think that's an observation, because the economic impact is not purely measured by the health capacity. So we're talking about the health capacities of the health systems of countries, and also it depends on the demographics. So, for instance, in the European area, there's a large number of deaths because of the demographics, but the economy is still quite strong when compared to developing countries like us in Asia. So in our case, for example, here in the Philippines, the death rate is low. I think it's low,
Okay.
while the cases are very high. So it is a question of the of the severity of the disease and the capacities of the health system. So I think that's the reason why you have this almost like conflicting data coming out.
Okay.
Yeah.
Okay.
And
So my next question, do you want to
yeah,
add something?
yeah, and also probably now countries like Sri Lanka, right? Most of the economic activities are hidden activities, right? Those are not counted towards the GDP or whatever the formal calculation. There might be a huge economic loss, but still those are uncounted, right?
Yes.
That is
Undocumented.
not known. That is one reason. The other thing is economic loss may be the long-term phenomena, but the death and those things are very short-term. Immediately you can see the impact, right? By counting the number of death, number of severe cases, and so on. But the economic impact is not like that. It's gradually growing up in most of the countries. At the end of the day, I think it takes time to even to calculate the total damage. It takes more time, right? That's why probably that's one of the reason.
Fair point. That's a fair enough point. So I think we should be looking into maybe 6 months post-COVID to see the real economic impacts that countries have had. It brings me to my next question. Specific to each country, I think you can go first, Dr. Vasanta. Uh, have there been any financial relaxations or tax exemption from small and medium-sized enterprises that have been affected by the pandemic in your particular country? And then Dr. Alvin can take it up.
Yes, I think government provided various relief, especially focusing the small and medium sector industries. And also they provided the relief for the tourism and other several even big industries, right? And all those the impact of those relief is still not known, as I was telling you, because it takes time to evaluate the exactly what impact of those, the money that we have, government has spent so much money in order to recover those industry, but still the impact is not known, right? It takes time to evaluate those impact. Anyway, we had in Sri Lanka, I think not like other country, we I think at the beginning I wanted to tell you this. Our initial condition was very poor when we faced the COVID-19, right? If you think about the macroeconomic variable in the country, by 2019, because of the mismanagement of the economic activities of the previous government, we were almost all the economic activities went downward. Our economic growth came to like 3.1 or something like 2.9 or something like that, right? Therefore, our initial condition was not so well to face a pandemic like this. That is one thing. The second thing is there was uncertainty about the Sri Lankan election. Therefore, there was not a parliament. President was running the country alone. Actually, due to the COVID-19, there was no way to, implement the election. Therefore, only monetary policy was working in the country, because fiscal policy is normally need to be approved by the parliament, right? As that was not functioning well, monetary policy was implemented country. Under the monetary policy, various relief towards those industries was given.
That makes sense. That does make sense. So, Dr. Alvin, the same question goes for you now. So, government reforms around taxation, tax exemption, financial relaxations.
Yeah, actually, the Philippine government, we still have not passed. There's a proposal to cut the corporate income taxes, but still that has not passed our our parliament. What we have passed are stimulus measures to help the corporations and small and medium enterprises in the form of relaxed credits and guarantees, so that they can continue to borrow and operate. However, it's not as large as many countries were giving in our region in Southeast Asia. I think the Philippines is one of the smallest stimulus package. However, of course, it has to do with the capacity of government to to continue to deficit fund it. I mean, how do you fund the amount of stimulus without tax payments from firms that can pay taxes? So it's like a chicken and egg question. So you are forced now to go to borrowing. So the government borrowed domestically and also internationally to be able to fund the requirements to support the local firms and also to support families. We gave like similar to the U.S. Stimulus checks,
Mhm.
like stimulus checks, but of course it's not much, but to help people tide over for the next 2-3 months earlier. But now all these are gone, so we have actually started to reopen the economy because that's the only way for activities to continue, for jobs to be generated, for businesses to operate. Yeah.
Okay, okay. So I have Dr. Bengali with me on the phone, so he'll be talking from my screen. Dr. Bengali, my question to them was that what kind of government relief packages has Pakistan been offering its citizens in the form of any financial relaxations or tax exemptions, etc., or any other policy that they've come up with? Pakistan, I believe, was also working on the SAS project for giving out, I believe, loans, and there was something around electricity also. Are you able to hear me, Dr. Bengali? Great. आवाज बढ़ाओ। मैंने कहा था full do.
With packages gradually one by one. The first package was through the SAS program. I think they have distributed very large amount of 19 billion rupees in the first stage, 3,000 rupees per family. And they have also given breaks to businesses with the purpose of persuading them to continue paying salaries to their workers. There have also been some export incentives. There have been incentives for the construction sector because construction sector is labor intensive. So I think the government has come up with some packages. The problem in Pakistan is documentation. Workers in our factories and offices are not necessarily registered. So if you give a break to any enterprise that this is a loan or a tax break to enable you to continue hiring your workers, there is no assurance that even after receiving those incentives, the company will actually hire those workers because the workers are not registered anywhere as workers. The other is that the SAS program, which gave direct support to families, about 2 to 3% of the very, very poor families they don't have the national identity card, and so they're not registered with what was the Benazir Income Support Program. They are mobile populations. They're in the rural areas. They move from farm to farm with families wherever they find work. In urban areas, they move from construction site to construction site, and they set up their residence while the construction is going on. So that population has not government has not been able to reach. So while the government has made efforts at both ends by giving direct support to families and giving breaks to industry and businesses, there are gaps which have not been covered because, as the Solanki said right at the beginning, that we don't have the social security system in place which the Western world has.
Yes.
So we don't have a system of unemployment insurance. We don't have records of who's employed and who's not employed. And the gap, which in some ways economically disenfranchises people, is fairly large. The government has made efforts to whatever capacity did exist.
Okay, so now my next question is around to Mr. Murtaza Solanki. Like Dr. Bengali was mentioning, we do not have a social security system in place like the Western countries. Could you give us a little analysis of how the Western countries like the US, UK, Canada have responded in terms of revival mechanisms, especially in terms of packages given to the lesser fortunate, or those who are affected by COVID-19 the most?
Well, whatever we know so far, especially in the United States, they have announced different, revival packages to industry, different sectors of industry, and the social security network that has existed in the United States for a long time, that continues to provide some kind of support. How long will that be sustainable? We have yet to see, because COVID-19 has probably hit United States real hard. But in countries like Pakistan, as Dr. Kaisar Bengali rightly told you, under a SARS program that current government did, spend around $0.86 billion in the dollar amount to 12 million families. And they did announce in June, the government announced 1.2 trillion rupees recovery plan with 100 billion support fund for businesses in tax refunds, etc. They also cut down on the interest rate in June, 225 basis points. So there are different measures being taken, but in countries like Pakistan, where in many establishments and businesses and factories, there are no trade unions. There is a system called contract system, where the employees are not directly employees of that establishment, but are outsourced to some other company. So how will those benefits be transferred to people is yet to be determined. But overall, the general mood of economic recession would ultimately hit those social security systems, even in United States and Europe.
Okay, so my next question, we are receiving a couple of questions on the screen also, if my panelists would like to answer that. So first off, I want to question about bilateral trade, the impact we've seen world over on export and import, country specific, if Dr. Alvin, Dr. Bengali, and Dr. Vasata could point out. A global bilateral trade, what has been the impact and how long do you foresee we'll be seeing the same effects?
Who is this question for?
You can go first, Dr. Bengali. You can go first.
Okay. As I said in my opening remarks, global trade, I think, will certainly shrink. Because of the recessions, demand in the rich countries will be affected, and because of that, exports of developing countries will be affected. Now, without the export income, without the dollar income, a country like Pakistan will not be able to import as much as they have so far.
Yes.
So I think global trade, even bilateral trade, will shrink. To what extent remains to be seen. It also remains to be seen how the pandemic pans out. It is sort of out of control in the United States right now, which is the largest economy in the world. So, and also depends how soon an effective vaccine is developed. But on the whole, I think in the next couple of years, we will probably see global trade shrinking.
Okay, fair enough. So next up, Dr. Alvin, if you could kindly please mention, talking about bilateral trade with respect to Philippines.
Yeah. Well, the Philippines, the Southeast Asian economies, the 10 economies in Southeast Asia are closely linked in relation to trade. So, and our major trading partner basically here in this part of the world is China. So when the Chinese economy recovers, basically it will pull up the value chain. So from Malaysia, Thailand, Indonesia, Philippines, Singapore, and Vietnam will definitely benefit from it. However, with localized lockdowns in some places, that will still be a challenge. And of course, this is as a global supply chain. You see, not countries here are producing products that are products of other countries as well. So the resurgence or recovery of China and major value chain markets will actually pull up the economies in this region. But having said that, that is a dependent kind type of trade. So, uh, like the call of Dr. Benzali earlier, it's really very good to go back to develop your domestic capacities, and the extra will be produced and can be exported as well, particularly in the area of agriculture. So these
Mm.
are opportunities that are open right now, and so we can take advantage of it as well while waiting for the rest of the value chains to recover. Many of the exporters, for example, here in the Philippines, while waiting for their main products, they've shifted to producing essentials like the PPEs for the medical personal equipment, and then the
Mm.
mask and the like. So it's if they have the same equipment to be used, then they can adjust. But those that don't, that are practically dependent, for example, in manufacturing of automobiles and the likes, and electronics, that would be a challenge. So it is important right now to start looking at other markets to develop and not wait for trade to recover as a whole. Thank you. Okay.
Dr. Vajiha, you are muted. You have to unmute yourself.
No, sorry. My apologies. So, Mr. Solangi, could you give me a global overview of bilateral trade, how that has been impacted?
Well, the biggest casualty of COVID-19 is global trade, or even globalization in itself. Because as you can see, countries like Europe and America, where they used to receive lot of imports in terms of lot of goods produced by developing countries like textile and other manufacturing items from China and other countries. The demand has gone down. So Pakistani or countries like Pakistan, who used to export produce like textile, etc., they have gone down. So there is a global trend that you can find out. Another thing is that because of the US-China trade war that's still going on, we don't know how it will play out. Probably after November 3, when we have elections in the United States, we will see how China and US trade war plays out. But a lot of products that are produced in China will probably be affected. In South Asian East economies, as Dr. Alvin said, they are quite interdependent. But our region is badly affected. Even before COVID, our region was not connected. A lot of conflicts like India-Pakistan conflict that I earlier mentioned is a major hindrance. So countries like Pakistan, if we can't send our products to Europe and North America because of the demand cut, and our skilled and unskilled labor in Gulf countries, they will be sending less dollars. So there will be a huge financial reserves problem for countries like Pakistan. A lot of our even raw materials that we import, we would have less dollar reserves to pay for besides oil imports that we do. So these are the real issues. If countries of the South Asian region can resolve their conflicts, probably they will be in a better position. But domestic consumption is the way to go till the global economy comes out of recession mode.
Okay, so my next question is for Mr. Dr. Bengali. So this question came from our audience. You can go first, and then I want Dr. Basanta to answer it also, and Dr. Alvin. What can the public do to improve economics at a global level? Is there anything that the public can do and play a role, we as general population?
I'm not sure what, as individuals, the public can do. But largely, it's the macroeconomic framework that will determine how the public behaves. You know, if we can't. The only thing we can ask is for the public to reduce consumption of imported goods, for example. But making appeals to the public never helps. This is not how economies function. You can have some people responding, but by and large, it doesn't work. We will have to have government policy that reorients the economy towards domestic consumption. And of course, if instead of importing wheat, importing certain items, we import most of our cooking oil raw material from Malaysia, but we can grow, which is palm oil. But cotton acreage can be replaced with growing sunflower, so we can produce our own cooking oil, and that reduces the burden on foreign exchange. So, but this is the kind of restructuring we'll have to take. But these are not policy. These are not decisions that can be taken at the individual level. It has to be policy level, macro level restructuring that the government will have to lead.
Great. Would anybody else want to answer this question before I move on to my next one? Anybody?
Yeah, I think in the case of the public, what we can do is really just do what the government is asking of us in relation to how we do things at this pandemic, like wearing masks, social distancing, and being very careful and trying to avoid the things that could create more problems in society at the moment. So I think that's enough help that everyone can contribute, and that could bring back the economic confidence that the macroeconomy needed. Of course, that takes a lot of discipline, especially since we are not used to this kind of setup in the last how many years. Yeah, that's my take on this.
So because all my policy experts are here and a lot of you have had work experience with the public sector also, could I please have 3 suggestions each from each of my panelists and discussants about what kind of changes need to be made at a macro level to improve the dynamics of the economy? Anybody can go in first. Dr. Bengali, maybe you.
Okay. I've been saying that we will need to step back from globalization and do a bit of autarky, grow things of the essential items, like the essential food items, at least 5 or 6 items we should grow within the country, because we will just not have the foreign exchange to import them. Stepping back from globalization is one step. The other step that will need to be taken is stepping back from the market economy. Over the last 30 years in particular, we have built our economy around the market. And the market, of course, in a crisis does not respond because there are no profits to be made by responding to a crisis. And country after country, the state has stepped in. In Spain, they have virtually taken over all hospitals. And in Pakistan also, the state has to come in. The state will have to determine for example, the state will have to determine what percentage of the land will be allocated to growing what crops. And of course, incentive structure will have to be created. But it should no longer be to the individual farmer to decide what crops they will grow. Because what has been happening in the last 20 years, food crops are being replaced by cash crops. But that cannot be allowed anymore.
You're right.
Food is a basic need of consumption, and that the state will have to ensure. So I think the state will have to come into the picture much bigger. The market will have to step back, because this is a crisis that the market is unable to resolve. The market only follows the profit motive, and here for the next couple of years at least.
Are the rest able to hear Dr. Bengali?
Beg your pardon?
Yes, we can hear you.
Yeah. So the profit motive will have to be replaced by the welfare motive. The welfare motive will have to dominate, and which means the state will have to come back. So two major changes, structural changes that happens is globalization steps back and the market steps back.
Good, fair enough. Dr. Vasanta, do you want to go next? Same question.
I think that is what was happening exactly in Sri Lanka at the moment. Now, with the COVID government imposed various restrictions on imports because of the exchange rate foreign reserve issue. Then as a result, what was happening in the country, a lot of the market prices of most of the domestic commodity went up. As a result, most of the people started producing those commodities. This is happening at the moment. That is one thing. The second thing is, I think we had this export and import market. We didn't gain any advantage. A few years ago, when we were doing the analysis, we found that even the national flags was imported from other countries to Sri Lanka. This was national flags in the country was imported from other countries, right? This was not so good as a country. Therefore, I think COVID brought us a good future. That is what I believe. Most of the uncultivated area now cultivated, and most of the abandoned business now they are booming in the country. Therefore, I would expect within very short period, this COVID, we will get a positive impact from the COVID, especially the positive economic impact from the COVID.
Okay, fair enough. Dr. Alvin, do you want to go next?
Yeah, that is it's quite what have been suggested. They are interesting, and we want to do it. Unfortunately, there is also a particular requirement to make all of this work, which is really the governance capacity and the institutional capacity of states to be able to put the welfare of people at the center of this recovery that we want to do. And it's also, of course, dependent on the private sector if they can do it. And so, yes, we set aside all the targets and spend as much as we can. Our governments should spend as much as they can to be able to bring up the welfare of people. However, I believe that the markets can also work along this line. By government takes the lead, and the markets, the private sector in this context, come up as a public-private partnership, because the government alone may not be able to do this because of the huge impact, because this is the first time we are experiencing a crisis, an unprecedented crisis, bigger than the comparable time is only after World War II. So that's a huge uh, burden on governments all alone. So governments and private sector may need to work together, since many of the private sectors over the years, many private firms have earned enough resources that they can help the government in trying to bring back the economy as a whole. So I agree, we set aside the profit targets, set aside the government targets for growth, but pull up the welfare of people, but not a pure government activity, but a public-private partnership.
Yes, I agree with Dr. Alvin. When I said the market has to step back, I didn't say the market has to disappear, because what we need and what we have successfully experimented in Pakistan is public-private partnership, not just in the economic sectors, but also in the social sectors. We've had infrastructure built by a road, highway built with public-private partnership. We've had schools managed with government schools managed by NGOs. These are very successful examples, and I think the three-way partnership of government, private sector, and the social sector will have to be strengthened. So far it's been a small scale, but these will have to become large scale. Governments cannot replace the market, but at the same time, the market will have to step back. The market has attempted to eliminate the government, and that, of course, has not worked. Government will be the driver in the seat, and the market will be a partner with the government.
Okay. Mr. Murtha, what is your analysis of the situation? You've been hearing from all three counterparts, panelists here.
The heart and soul of this entire debate, as I can understand, is keeping people at the center of this entire crisis. That means you need more transparency and more democratization in all economic and social spheres of the countries. So the role of state would increase, but also the input of the people would have to be upgraded. That means in countries like Pakistan, you would have to cut down your non-developmental expenditure. Non-combat defense expenditure would have to be cut. You would have to focus more on feeding your people, so focusing more on agriculture and agricultural produce. That means you would have to rely and invest more on renewable energy resources of solar and wind and water. So you would have to conserve your foreign exchange reserves, and also put in place the leadership that focuses more on conflict resolution in our region. So you have to spend less on armaments and jingoistic policies and promoting intra-territorial trade in our region. That's missing from this economic picture of South Asia. All these things put together would alleviate those problems that we are facing in post-COVID-19 situation.
Okay. I have a couple of questions that, thank you so much, Murtaza Saab, for this really nice summary. I have a couple of questions that are coming from the audience, and I'm going to take them one by one. So one question, whoever wants to go first can answer. Which strata of the society was affected the most and why? Economically. Anybody can answer. Any takers?
Uh, I can, well, I was waiting for Dr. Alvin or Dr. Samatha to answer, but any crisis, those who do not have saved assets to fall back on suffer the most. And this crisis is no different. Even, I think Dr. Murtaza Sahab did mention the democratization and transparency. But where a state is essentially catering to the elite, any crisis that comes, they will try and squeeze the elite. Last couple of weeks, Karachi, for example, have seen unprecedented rains and flooding. Now, part of the reason for the flooding is that the rich have built their houses and buildings on waterways. So when the water could not flow into the sea, it causes flooding. But instead of demolishing those, the government has begun to demolish the poor housing, thatched housing that they have built. So it is not that the poor suffer because if I cannot leave my house for a week, there is enough food in the house stocked for me and my family to keep feeding. But the poor simply do not have the money, the cash, to go and buy food for a week or even for 2 days, and they have to go hungry. But when the state also hits out at the poor and dispossesses them of their home and their businesses on the grounds that they were illegal encroachments, whereas the illegal encroachment of the rich and the powerful is never touched, which actually has caused the damage, then you have the poor suffering from both ends. They do not have the savings to be able to tide over the crisis, and then they are hit by the state policies and the bulldozers that come and remove their homes. So the poor suffer. The rich have enough cushion to sustain any crisis.
Okay.
Over.
Yeah, it does make sense. So another question, I think Dr. Vasada was mentioning that it's going to take a while to assess the true impact of the economic crisis. So one of the questions that came from our public was that when do you think we'll be able to see the full picture of the pandemic? The Spanish flu took a very long time. Took a major hit. The Great Depression was a major hit. So, how long do you think we'll be able to see how much we have suffered? Again, anybody can go in.
That depends on the health people's forecast, right? Now, health sector, if they says how low will it goes, then as an economist, we would say, the total impact, but still we don't know what is the end of the COVID-19, right? It will last another 1 year, 2 years, 3 years, and so on. Therefore, I don't know. To me, it's very difficult to predict how long will it take to forecast the full impact of the full economic impact of the pandemic.
Okay. Does anybody else want to add something before I take the next question?
Because yes, go ahead.
Yeah, my thinking is that this, as I said, this crisis, we have not seen the bottom until people have become adjusted to it. And without the vaccine, even if we have the vaccine in a year, the distribution alone of the vaccine will take at least 6 months for the rest of the world, or at least a year. So we're looking probably at 2 years, the earliest, when we can be confident enough to be going back to life as it used to be. And so that's the only time you'll be able to take the full impact. But even after that, the economic impact, as already mentioned by our colleague in Sri Lanka, is not countable by days and numbers of tests and the number of people infected, because there is the economic socio-economic impact is not on a day-to-day basis. As a closed company, the impact will take years to bring it back where it used to be. So it's not very easy to answer that question.
Okay, so my next question is going to be, even though it's not directly in economics, but I'll be talking about bilateral and multilateral donations. The world is going into debt. What do my economists have to say about that? How long do you think we will be able to recover out of that to pre-COVID times? And is there any role that bilateral uh, funding agencies have to play in that?
I
Again,
think, yeah, there will have to be a package of debt relief for countries and for businesses, without which I'm not sure if either countries or companies will be able to bounce back into any kind of pre-COVID sort of levels. Debt relief will have to be part of the recovery for the entire world.
anybody else wants to add to this?
And also, what I feel that this is not countries issues or regional issues and so on. This is a global issue. Then it's not good to expect help from others, right? Now, therefore, rather than trusting funding agencies, other countries, individual countries should take necessary policies at least to survive, for the survival, right? That's what I feel. I think all countries, they have to take some individual decisions to protect their countries or about their future.
Okay, fair enough. Okay, so I think it's almost 90 minutes into the program. I'm just going to ask each of my esteemed panelists to give 2 takeaway messages that we've learned from COVID-19, economic impact, how things can improve in the future, what should we all be doing about it. 2 each, and then I'll be closing the program. Dr. Alvin, do you want to go first?
Yeah, well, the COVID crisis has really pushed countries, including our own country here in the Philippines, into a challenging situation. But there is a learning curve. People are learning. 6 months into the crisis, we are learning. The government is learning. Countries are learning. Health system is learning. People are learning. Businesses are learning. And so, even I think in the next few months, we will be able to get through this. But the impact would definitely change the way we live, the way we do things, and the way we are um, uh, taking care of the environment. So this is also like a blessing in disguise for the environment, and also for the way we do families, the way we do businesses, and the way we operate in many ways. So we should take advantage of the opportunities, but at the same time address the issues that need to be addressed head on, and not wait until it's too late.
Thank you. For me, I think the biggest thing would be investment in primary healthcare structures. Had we done that, had we had an active surveillance pre-hand, had we allocated more budget on health and the GDP, things would have been different. But that's my own perspective. Who wants to go next? Dr. Basara, do you want to give your takeaway points?
Is that for me? Okay. Now, yeah, I think maybe my answer is biased towards the environmental side. What I always believe, all these issues are emerging because of we are excessive using of the environmental resources and damaging the environment. That is the fundamental things that I believe. Therefore, even the COVID is part of it, and now you understand the damage of it, right? Therefore, what I always believe is countries, all the countries in the world, they should come to a consensus. They should come to a unit decision regarding how we are operating the economies in the world, right? Now you can clearly see that over the 3 or 4 months lockdown period, you clearly see most of the environmental indicators are, they had a positive sign. Environment is improving. Likewise, what I think is, like every 4 years, why can't we stop all the economic activities and be at home, global level, right? That means we every, like, let's say 4 years, we allow environment to regenerate its capacity to protect us, right? I believe that at the global level we have to come to a conclusion like that. Otherwise, the COVID is only one thing. There may be more and more things which will emerge with the time due to the environmental damages that we are doing.
Makes sense. Thank you. Thank you for your views. Dr. Bengali, do you want to go next?
Since time immemorial,
I think
the
he's
rich and
having
the
some
powerful,
screen issues.
the rich and the powerful have thought that they can create a world of plenty around themselves and push the rest of the population to the periphery, and they will be safe and they can lead a good life. This pandemic has shown that there is no safe haven anywhere in the world. It has affected the poor and the rich equally. It has affected the poor and the rich countries equally. So I think this is a message that has been sent to us, that humanity and the globe is one. You can't have one part of the body healthy if the other part of the body is diseased. And we are one body. The whole humanity is one body. I hope that this pandemic will give the message to the rich and the powerful that they cannot continue to pursue their own prosperity at the expense of the prosperity of their neighbors in their own country and in other countries. I hope that this crisis will create this awareness for equity. Thank you.
Dr. Wajiha, you are muted. You would have to unmute yourself. Dr. Wajiha, we can't hear you. You have to unmute yourself. Dr. Wajiha, you have to unmute yourself. We can't hear you.
I'm sorry, I was muted. So, Mr. Murtaza Solangi, I'm saying I'm going to defer it to you now to summarize today's findings being our discussant and your takeaway point.
Well, one thing is clear. This COVID-19 has been a major wake-up call.
Okay, so I was saying that if you could please summarize today's lesson learned and learnings from today's session and summarize it as a discussion for today.
This COVID-19 has been a major wake-up call to the entire global community. Human beings as a species. Can you hear me? Can you hear me clearly?
Yes. Okay. I can hear you.
Yes,
okay.
I can hear you. Yes.
This COVID-19 has been a major wake-up call to the entire global community. The world will not be the same, vaccine or no vaccine. It's not about just upgrading your healthcare system. It's about changing your relationship with the planet Earth. The way selfishly human beings have exploited the resources of the nature is not sustainable anymore. We would have to drastically and radically change our relationship to preserve nature compared to other animal species. Otherwise, COVID-19 is just a small trailer. The real film is yet to come, because if we did not change our ways, the existence of human beings on this planet would be very short-lived. So we would have to change everything, our ways of surviving and living on this planet Earth.
Hello, are we there?
Yes, we all are here.
Oh, okay. Sorry, I wasn't able to see. So I just want to thank all of my panelists today for being here. I want to thank my discussant. Thank you all for taking your precious time out to be here. I believe our audiences all have learned a lot. There were quite a lot of questions that came from them. So thank you for being part of this program. I'll be here within the next week, and our next episode is going to be on environment. So everybody stay tuned, and I'll see you next week. Thank you very much.
Thank you.
Thank you.
Thank you.
Thank you very much.